Hey pal, I saw your dad in the news.
What? When?
Calm down pal, let's go and watch it.
Okay.
Good afternoon, ladies and gentlemen. Our topic for today is managed care pharmacy, but first let's welcome back my partner Mrs. Cruz.
Good afternoon, partner. Good afternoon, viewers.
Partner, can you tell us what is managed care pharmacy, because I've heard that you also take a pharmacy degree before.
Okay, partner, but first, I asked you, what is managed care?
Managed care in general, to efforts to coordinate, rationalize, and channel the use of services to achieve desired access and outcomes while controlling costs. How about you?
For me, managed care is an organized healthcare delivery system with three major goals. First, improve quality and accessibility of healthcare. Second, improve outcomes and overall quality of life for patients. And third, contain medical costs.
Oh, I see, but what is managed care pharmacist?
Managed care pharmacist is a pharmacist working in a managed care environment, which intimately involved in the care and course of pharmaceutical treatment, and plays a vital role in contributing to positive patient outcomes.
Partner, is there a work setting of managed care pharmacist?
Yes, because the managed care environment offers a great opportunity for pharmacists to move away from the technical tasks of pharmacy to assume greater responsibility for patient care. Pharmacists involved in managed care pharmacy are employed by various managed care organizations, including health maintenance organizations, HMOs, and pharmacy benefit management companies, PBMs, as well as by retail pharmacies, hospitals, integrated health systems, the pharmaceutical industry, academia, and consulting firms.
Do you think pharmacy student must consider managed care pharmacy as a career?
Of course, partner, because managed care has risen to dominance in the United States healthcare system. And the advantages of choosing managed care pharmacy as a career are the opportunities to provide comprehensive pharmaceutical care and to work directly with other healthcare providers to determine the most effective pharmaceutical treatment for patients. If you are a member of a managed care pharmacy team, you have the opportunity to wear many hats. There are numerous job opportunities that offer competitive compensation.
Regarding work directly with other healthcare providers, what do you mean?
Oh, that is the key players in managed care.
There it is, man. You're a dad.
Quiet, man.
Managed care key players? What is that, partner?
Managed care key players are the health plans, pharmacy benefit management firms, pharmaceutical industry, specialty pharmacy providers, retail pharmacy, consulting firms, and academia.
Okay, partner, but are they connected to the pharmacy?
Yes. And to know how they connected, watch this. Roll VTR.
Hello, my name is Bryce Love. I am a graduate from the Ohio State College of Pharmacy. Soon after graduation, I started my career as a staff pharmacist at Medco, and today I am the pharmacy director. Today I would like to introduce you to our pharmacy practice by giving you an overview of the company, our prescription processes, and a typical day in the life of a Medco pharmacist. First, I'd like to provide you a brief overview of the company. Medco is one of the nation's largest pharmacy benefit managers. Pharmacy benefit managers provide prescription services for employees of major companies. Our clients include both private and public employers and healthcare organizations. Currently, we provide prescription drug care to approximately 60 million Americans. We have over 15,000 employees, including 2,200 pharmacists nationwide. Additionally, Medco has the nation's largest mail service operation. Our facilities are spread out across the country and include 9 mail service pharmacies and 4 call center pharmacies. For the last 7 years, I've worked in the call center in Columbus, Ohio. Pharmacists in the call center communicate with physicians, other healthcare professionals, and patients by the telephone to clarify prescription information or counsel patients about their medications. I currently manage a number of different programs within the call center. These programs include health management to assist patients to optimally treat their diseases, formulary management to assist our patients and clients to use the most cost-effective medications, drug utilization review to evaluate the safe use of medications, medication therapy management to help patients get the best outcomes from their drug therapies, and patient counseling on their current medications. In the next few minutes, I'd like to describe how Medco operates within the pharmacy benefit industry. Our operation has separated the process of filling prescriptions into two areas: processing and dispensing. Pharmacists in our processing areas make sure that we have all the information that is needed about our patient's prescription before it is forwarded electronically to one of our dispensing pharmacies. The dispensing pharmacies will prepare the prescription for delivery to our patients. Through the separation of processing and dispensing, Medco is able to do something that has never been done before. We route prescriptions to particular pharmacies that specialize in that type of therapy. These specialized pharmacies are called therapeutic resource centers. The pharmacists in these centers receive specialized training on the disease states they service. For example, our therapeutic resource center in Columbus handles prescriptions for oncology patients, which allows those pharmacists to focus on helping cancer patients from across the country. Medco has the ability to dispense over 2 million prescriptions per week through our automated dispensing pharmacies. To put this another way, it would take a typical pharmacy more than 16 years to dispense the number of prescriptions that we can do in 6 days. You may be wondering exactly how prescriptions get filled within the pharmacy system. Once a prescription is received at one of our processing pharmacies, an electronic image is prepared using a color scanner. All of the prescription information is then reviewed by a pharmacist. The pharmacist completes a drug utilization review to see if it is safe to add a new drug to the patient's current regimen. He or she will also check the patient's insurance plan to see if the newly prescribed drug is covered. The pharmacist will complete any necessary physician or patient calls to resolve any issues about the prescription. If the prescription is changed, the pharmacist will complete a final validation before dispensing starts. When processing is completed and the pharmacist has confirmed each prescription component, the prescription is transferred electronically to one of our dispensing pharmacies. Before dispensing begins, dispensing cells are loaded with medications. Each dispensing cell passes many quality assurance steps, including barcode scans and visual checks. At the same time, new prescription bottles are heading down a 2-mile track for filling. Our dispensing process uses hundreds of barcode scans to track the progress of each order. Concurrently, personalized information that's critical to the safety and proper use of the medication is printed for each specific patient. Carriers containing 20 prescription bottles move through the dispensing cells, which are connected by a single tube to ensure quality. This also ensures that there is no way for a medication to take a wrong turn. Pharmacists monitor the process at all times, and many quality checks and balances are built into every step to ensure safety. If there is the slightest doubt about the accuracy of the order, that bottle is pulled and routed to a pharmacist for physical inspection. Finally, to complete the process, a machine applies the caps on each prescription bottle. The patient literature and the filled orders are matched and sealed to be delivered to the patients. Within minutes from start to finish, the medication is on its way. So, what is the pharmacist's role in this process? Pharmacists dedicate a portion of their time completing a particular function, such as drug utilization review or doctor calls, and then rotate through other activities that change throughout the day. This keeps every pharmacist functioning at a high level in multiple areas within the pharmacy. A pharmacist might start the day reviewing patient profiles for possible drug interactions. Here, the pharmacist will talk to physicians or patients to make sure that drug therapies are appropriate and safe. Next, the pharmacist could transition to the doctor call area. Our doctor call pharmacists review prescriptions that lack the necessary information, such as the appropriate drug dose or correct directions. The pharmacist may need to call the prescriber to clarify any information that is missing from the prescription. Another function that pharmacist performs involves validation of prescriptions imaged into the system. Since pharmacy technicians perform the actual imaging, the pharmacist will check their work. And yet another area for our pharmacist is the seniors DUR area, or drug utilization review. The pharmacist analyzes possible drug interactions to protect our elderly patients, utilizing pharmacy prescription claims and other patient-specific information. If necessary, the pharmacist will call the prescriber or patient to review specific therapy recommendations. To recap, in the last few minutes I've provided a brief description of the pharmacy practice at Medco. In closing, Medco allows pharmacists to focus on clinical activities to improve the quality of life for our patients while helping reduce healthcare costs. These activities make our pharmacist a valued member of the healthcare team.